Good day. I am Hannah Gando, your nurse for today. For verification purposes, could you please state your full name and date of birth?
I am Mrs. Madeline John, born on May 22, 1995.
Okay. Mrs. John, today I will perform the Leopold's maneuver to determine the position and placement of your baby. We need to raise your clothes and expose your stomach or baby bump for me to feel for it. Is that okay with you?
Yes.
Okay, so the Leopold's maneuver is consist of 4 maneuvers. The first maneuver will help to determine the part lying in the fundus and identify if your baby is in breech or cephalic position. Then, the second maneuver will help us to determine where side is your baby's back and extremities. And if we locate the back of your baby, we can place fetal heart monitor to detect the fetal heart tone. Then, the third maneuver will help us to determine if baby's head is engaged in the pelvis. Then the fourth maneuver will help us to determine cephalic prominence and verify the positioning of your baby.
Close the doors and curtains to provide for client privacy.
Mrs. John, did you already went to the toilet and voided?
Yes, before you came into the room.
So, okay. Then can I request you to be on dorsal recumbent position wherein you will lay on your back with your knees flexed?
Yes.
Okay. Then, I will put a pillow under your hips to provide support on your back during the procedure. Is that okay with you?
Yes.
Okay. I will wash my hands, then I will be back in a while, okay?
Okay.
Mrs. John, I am now back and I already washed my hands and put on gloves. Then I will now lift up your clothes and expose your stomach or your baby bump. Is that okay with you?
It's fine.
Okay. Let's expose your baby bump. Then we will now start the Leopold's maneuver. The first maneuver, I will place my hands on your fundus. If it's soft, then it's the buttocks. But if I felt that it's hard, it's where the head is located. This part is soft, so this is where your baby's buttocks is located. Then I will now proceed to the second maneuver to palpate for the baby's back, arms, and legs. If it is hard, plain surface, it's where the baby's back is. And if it's bumpy and felt like small nodules, it is where the arms and legs are located at. This part is the arms and legs of your baby, and this part is where the back of the baby is located. We can place the fetal heart monitor here to detect the fetal heart tones. Then we will now proceed to the third maneuver. I will place my thumb and forefinger on your suprapubic region to check if the baby is engaged to your pelvis or not.
If it is movable, then it is not engaged.
And if it is not movable, then it is already engaged in your pelvis. So it is movable, so the head of your baby is not yet engaged in your pelvis. Then we now come to the fourth and last maneuver. In the fourth maneuver, I will feel for the cephalic prominence of your baby, and we will verify the placement and position of the baby based on the previous findings, okay? So we are now done, and we can now cover up your stomach or your baby bump. Yeah. Mrs. John, the procedure is now done, and based on my findings, your baby is in cephalic placement, and it is normal for the age of gestation of 27 weeks. Then perform hand washing and other infection control procedures. After doffing off gloves and washing my hands, I will now record my findings on the patient's chart. Mrs. Madeline John, age of gestation 27 weeks. Baby is in cephalic placement. Head of baby not engaged on the pelvis. Nurse's signature. Leopold's maneuver is now done and properly documented.